Well, we can shop in non-essential businesses. We can get our nails done in salons. We can have meals on restaurant patios or even small house parties in our backyards. Life is starting to look more and more like the before times here in Thunder Bay. So how close are we to putting concerns about COVID-19 behind us? And what do we need to do to get to the finish line? Here to chat about those topics and more is the Medical Officer of Health for the Thunder Bay District, Dr. Janet DeMille. Dr. DeMille, good morning.
Good morning, Amy.
So that push has been on to get people their second vaccine doses. Can you give us an update? How is that going?
You know what? That's going really well. We are certainly seeing very good uptake for the second doses. We had what appeared to be a bit of a slower week last week where I think across the district we had I think around 11,000 doses that were delivered. And that's a slower week for us. I think we're on track to maybe reach 14,000 plus what the pharmacies will do this week. So we are seeing very good uptake as we've always seen, and look forward to keeping that up.
Mm-hmm. So let's talk about first doses as well. So we had a provincial story in our news this morning about concerns that first dose coverage across the province has kind of come to a stall at this point. Are we seeing that as well in Thunder Bay, or have we kind of maxed out the number of people who have gotten their first dose, or are there more to capture?
You know what, I think, what it's following sort of a pattern that I had always anticipated, that we would have sort of a rush of individuals seeking their first dose, and it would take us sort of a while to get through that. And then at some point it would slow down as most people got their first dose. And, and I think that's what we're seeing. And we do monitor that. And certainly there's a lot of keenness right now around people getting their second doses, which is, and we're focusing on that primarily. But we still continue to encourage people to get their first doses. We're sort of reaching out in a number of different ways. And we see that first doses are still being done, and that's both through the various clinics and the primary care pharmacies that are happening.
How much of a challenge do you think it's going to be to get those last, I'm not sure how many it is, but say 30% or so of people to come and get their first dose?
Yeah, so I actually think it's less than 30%. In fact, I just checked the ministry website. So the ministry's numbers are a bit different than ours, but it does show that we're actually, as of this morning, at 84.6% in terms of the 18-plus population and closer to 83% around the 12-plus. So, the percentage, it's somewhere between, that 15 and 17% likely. But, we'll always be working on making sure that the vaccine is accessible to people to get that first dose. And there's likely different reasons why people aren't, haven't come forward. But we do see them, again, coming forward every day still to get those doses. And everybody has their individual motivations. But we are going to be moving forward with a more kind of a first dose strategy and really looking at what might be some of the barriers, what might be some of the issues, and doing more targeted, focused work to get those in. Like, for example, this week we're starting drive-in clinics at the CLE in the parking lot there, because we do know that some people, whether they have mobility issues or some people, other issues that they might not be able to, be comfortable in that sort of mass immunization clinic, but they might be very comfortable sort of in their car and receiving the vaccine there. So that's sort of an example of what we're doing. We're also increasing our work with primary care. Primary care has always been a big part of the immunization rollout, both here in Thunder Bay and the district communities. And we know that some people, if they're a little bit hesitant, maybe if they have sort of questions, that one-on-one interaction with their, primary care provider that they've been with, that's a really good way of getting some individuals immunized. So really looking forward to, having that vaccine that can go out to primary care so that they can do that, continue doing that work.
Yeah. There may have been people at the start of the vaccine rollout as well who might have wanted to wait before getting a dose because they were concerned about adverse effects. Now that we've kind of seen things going well, are you seeing any of those people who might have been in that camp come forward now and feeling more comfortable with the vaccines?
Absolutely. I think we're seeing that, or people maybe who didn't think that they needed to be vaccinated, and people that sort of feel, we don't really have much COVID. Maybe not, maybe a little bit, I don't know if it's procrastination or just sort of waiting, or their intentions were there, but maybe just not, that wasn't yet manifesting in action. So I think there's a number of things that are happening. And, I think what we've always found when we go out someplace, when we've done the neighborhood clinics, when we, did a clinic in the rural areas out in the Stanley Arena about a month ago, there are people that will, access those as opposed to some of the bigger clinics or other type of approaches.
Mm-hmm. Over the past year, our conversation have touched on mental health a number of times. And I know you had expressed concern about people's mental health this winter, especially when it came to kids not being able to go to school. Now that things have started to reopen a little bit, we can spend more time outside. Are you sensing an improvement in people's mental health?
So I think that, a number of things are likely contributing and to people feeling a little bit better. I mean, not only, I think our COVID situation is much better. And when you see that immunization number go up and up every week, too, I think that sort of, this community and in this area is being protected because people are coming forward and our numbers are really low. And I think that perhaps feels more comfortable to people, and what we know and what's being shown is that these vaccines work, and that we can be reasonably optimistic of the future. I think there's some uncertainty, of course, around the Delta variant and things that are happening, and what are things going to look like in the fall? But of course it's summertime and people can be out, and we've had some nice weather recently, so I think that's really helping people. I do think there are sort of long-term issues. I remain concerned about youth, especially youth in Thunder Bay who were really out of school since the beginning of March, and the value of school, and that the social and mental and emotional and educational, obviously, outcomes that are achieved when people go to school, and I'm hoping that this summer can be a time of some recovery around that, and then hoping to see schools really reopen safely in September.
Given the vaccination rate and the low case count, do you foresee any further acceleration of the province's reopening plan?
So these decisions, again, are made provincially, and of course there's that reopening roadmap that was laid out, and I think and I know there's lots of conversations and discussions and consultations happening at the provincial level, and public health has been provided with that. So, I don't see that there's going to be any sort of a regional reopening. I think it will be provincial, and perhaps, whether it's an advantage or disadvantage, we live in the same province. We are in the same province as like the GTA and some of those areas that have had some significant issues with COVID that are crowded, and of course we're also seeing the Delta variant. It's contributing to most of the cases, even though it's a low case count. It's largely the Delta variant, and there has been, spread or clusters of cases, and that's always a concern. And there's a lot of interest in what's happening in the United Kingdom or in Israel right now, where those case numbers have gone up, particularly in the UK. And just looking at the real world, real life. What does that look like in real life when you have a high immunization rate and people fully immunized, but the virus is still there, in particular an infectious variant like the Delta one?
Dr. DeMille, always so much to talk about. We'll have to leave it there for this week, but as always, I very much appreciate your time. Thank you for joining us.
Thank you, Amy.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District.